Our topic for this week is diabetes in pregnancy. Starting with classification of diabetes, just like we started with hypertension. Hypertension का classification और diabetes is completely different. Hypertension में we discussed that 20 weeks से पहले it is chronic, 20 weeks के बाद it is pregnancy induced. Diabetes का classification is not dependent on gestational age. So anytime at any gestation, if woman has been diagnosed to have high sugar, that is called as gestational diabetes mellitus, and that is not related to the gestational age. So you do screening test in every woman where you give 75 gram glucose, and if it is more than 140, whatever the gestation is, we call it gestational diabetes mellitus. Except in GDM, there is insulin resistance. That is why she develops GDM in pregnancy. The sugar levels are never very high. They are moderately high, but they are never very high. Very high sugar means HbA1c more than 6.5. Fasting blood sugar more than 126. Random blood sugar or the test of your OGTT showed to sugar to be more than 200. This is a very high sugar. This high sugar is not there in GDM. So if the sugar value are this high, then that is not GDM. Then that is a overt diabetes or pre-gestational diabetes. Means she was diabetic before pregnancy. So it does not depend on the gestational age. It depends on the values of the sugar. If sugar values are high but not very high, it is GDM. If sugar values are very high, it is overt diabetes or pre-gestational diabetes.